when somebody worries a lot, it's going to affect the levels of the different hormones. We have what we call the hypothalamus, pituitary, and adrenal axis. So there is an interaction between the hormones in the brain, that is from the hypothalamus and the pituitary glands, which are sent, the reflexes are sent to the adrenal glands, and this causes an increase in what we call the stress hormones, that is cortisol and adrenaline. So most of the times when these hormones are very high or they are not well balanced, it's going to cause a dysregulation. Dysregulation means an imbalance in the biochemical reactions within the body, whereby the body is going to release a lot of cytokines, which are going to promote more inflammation. And somebody who had a small wound, the wound ends up becoming bigger and bigger because the stress hormones were very high, and the person, because the person was stressed up, they kept worrying all the time, they were anxious, they were depressed, the stress hormones rise up, and somebody progressed because there were more inflammatory mediators or cytokines that were released into their system. The other way that mental health or instability affects cancer care is that most of the patients who have mental health issues, they tend to withdraw from care, and we tend to lose them in terms of following up. They do not come to the hospital on appointment. We schedule appointment to receive treatment in 2-3 weeks, and you find somebody comes after 3 or 4 months. So, and you find that most of the time cancer treatment works in cumulative doses. The dose that I give today will be the foundation. It will lay the foundation for the next dose. And the next dose combined with the first one makes another foundation for the third. So in that cumulative order, the chemotherapy drugs are able to fight against the cancer cells. So if a patient is not adhering to treatment, is not fulfilling the appointments because they are mentally down, they are mentally affected, it's going to eventually affect the outcomes of treatment.